Hey y'all, it's Dr. Tiffany. Back again. My last video was meant to be a little bit different than the last few, which have been all COVID all the time. I wanted to remind people that there's reasons other than not getting COVID for a living. But today, this one is about COVID, and it's about COVID in kids, okay? Now, I apologize for having you look down and read, but I can't possibly memorize all these statistics, okay? Okay, so without further ado. Okay, so stats. 1 to 3 to 3.5% of hospitalizations are pediatric, okay, and that's under 18. 520 are dead across the country. That's compared to 620,000 people nationally. That's really a small percentage, 520, but it's an incomprehensible loss for the families of those 520 children. May you never know that pain. The following states are having exceptionally bad spikes: Texas, Arkansas, Louisiana, Florida, Alabama, Indiana, Missouri, and South Carolina. Okay, 39,000 kids had COVID in the third week of July, and 72,000 in the fourth week of July. That represents 19% of all cases. And of course, Florida leads the way with 32 kids a day being hospitalized. There's a lot of problems with co-infection with RSV, because RSV is present in the community in large numbers, and it'll add to the respiratory difficulties of COVID. So a lot of times co-infection is a factor in hospitalization. Okay, so good news is that Pfizer is looking to get approval for the vaccination for ages 2 through 11 sometime in September. I don't know the exact date. Okay, I don't work for them or something like that, so please don't ask, because the answer is I don't know. September. Okay, Moderna, 6 months to 11 years old, that we're looking at winter, which is November through February at some point. Johnson & Johnson, who knows? I haven't been able to find anything about that. So who does it affect? Majority that gets affected are Black and Hispanic. That represents 61% between the two, or 62% between the two groups. 32% Hispanic and 30% Black. Okay, whites make up 29% of the kids that get infected. The remainder of races and ethnicities make up the remainder of the percents. 61% are male, and the most commonly severely affected age range by numbers is 5 to 9, but that is also because the next group, 10 through 15, some of them get the vaccine, okay? For very severe COVID infections is 4,196 is the number recorded so far, okay? So the thing is COVID doesn't hit kids as hard, but it still does, and they still infect other people, okay? So stay safe.